Is Laura, and I'm going to be discussing binge eating disorder. So, first of all, I'm going to look at what eating disorder is, who it affects, and then I want to present the three different sides for treatment options from what I can tell from my research. So, for many years, in the Diagnostic and Statistic Manual of Mental Disorders, binge eating was only classified in an appendix under the eating disorders non-specified. However, in the DSM-5, the most recent one that was released in May of 2013, binge eating disorder is now its own diagnosis. The American Psychological Association made this change because they wanted to increase awareness and the differences between binge eating disorder and overeating, because some people get them confused really easily. There was also many studies that showed that a large portion of those diagnoses from the eating disorders non-specified were actually binge eaters, so it deserved its own category. According to the Binge Eating Disorder Association, binge eating is the most common eating disorder in the United States. In adults, it affects 3.5% of all women and 2% of men, and up to 1.6% of adolescents. Binge eating disorder affects women slightly more than men. Estimates indicate that about 60% of people struggling with binge eating disorder are female, while 40% are male. Binge eating disorder seems to affect all different races equally. There's not one that stands out more in all the research that's been done. These, however, show that in women, it's most commonly in early adulthood, but in men, it's common in midlife. There was a French study that found that roughly 1/3 of their binge eating disorder patients regularly used extreme weight control practices, but that issue merits continued research. So, what causes binge eating disorders? Like a lot of disorders, this isn't something that is known, and there needs to be more research to pinpoint exactly what it is. But like other eating disorders, it seems to be a result of psychological, biological, and environmental factors. One study shows that nearly half of all people with binge eating disorders have a history of depression, although the exact tie and link is really unclear for that. Many binge eaters report that anger, sadness, boredom, anxiety, and other negative emotions trigger their episodes of binge eating. Eating disorders also tend to run in families, and so that is people with binge eating disorders tend to come from families that overeat or put an unnatural emphasis on food. So, you were good today at school, or you had a rough day, so here's a cupcake. Those families use it as a reward or a way to kind of soothe and comfort. And according to the DSM, there are 4 key diagnostic features of binge eating. First, an individual has a recurrent and persistent episodes of binge eating. Secondly, binge eating disorders are associated with 3 or more of the following: eating much more rapidly than normal, or they eat until they're feeling uncontrollably full, eating large amounts of foods when not really feeling physically hungry, eating alone because of embarrassed of how much the person is eating, feeling disgusted with oneself, depressed, or really guilty after overeating. Now, another one is marked distress regarding binge eating, and then the last one is the absence of regular compensatory behaviors, such as purging. According to Cynthia Bullock, every binge is different, just as every craving is different, but every binge eater is different, but the scenarios are all the same. Dr. James Hudson of Harvard's McLean Hospital says of binge eating, like the alcoholic who loses control after their first drink, these people, binge eaters, can't stop at just one cookie. So this brings us into looking for effective ways into treating binge eating disorder. Timothy Walsh is a Columbia University psychiatrist who chaired the DSM group that work with eating disorders, and he suggested there's many ways that you can tackle treatment. Walsh says because the disorder is so multifaceted, there are numerous ways to treat it. There's a lot going on when you're trying to look at the utility of all these interventions. For many people with binge eating disorders, you can think of at least 3 potential targets, but it's not clear if you should aim at all of them at the same time or pick one. So there are really kind of 3 sides on this debate on the best way to treat binge eating disorders. Tori DeAngelis is a writer from the American Psychological Association, and she examines 2 of these opposing sides, and then one other side I put in through more research. So she says she explored this debate by looking at eating disorder experts if they should look at psychological or the weight issues first in treating individuals with binge eating. According to her, one side of the experts believe that binge eating is best treated by traditional eating disorder approaches. So, this would be your cognitive behavioral therapy or interpersonal therapy. These are more diagnoses and treatments that focus on helping the patients reduce or eliminate binge eating, but also exploring where are those feelings coming from and what underlying emotional behaviors are they saying? How can we improve this person's self esteem and things like that? Denise Wilfrey is a binge eating disorders expert at San Diego State University, and she believes that if we help people eliminate binge eating patterns, then it automatically has an impact on the body weight, and you don't really have to focus on that as much. So there's obesity experts on the other side, and they maintain that it's better to treat the obesity first. These experts believe that the weight needs to be addressed before the psychological problems. They say that they're also making an assumption here that they're assuming that all patients with binge eating disorder are obese, which there aren't really conclusive evidence to show that. There are people who have a normal BMI that are binge eaters and slightly overweight. And so this is putting a lot of emphasis on that overeating and obese side. There is a short-term intervention that goes along with this side called behavioral weight loss treatment, which is BWL. It aims at both weight loss and helping the client with new behavior patterns to increase the likelihood of that going into after their treatment is done. So a common practice of BWL in adults it's called LEARN, and it's lifestyle, exercise, attitudes, relationship, and nutrition. LEARN. Arguments against this side point out how, like other eating disorders, binge eating disorder comes with distorted views about oneself, about food, and possibly with depression and other personality disorders. So only focusing on the weight without treating the client's other symptoms might prove damaging to the client because you're just kind of treating the surface cause and not the iceberg underneath it. People who use behavioral weight loss treatment say that it does eliminate binge eating, and there is some evidence for this, says Therese Wilson, a psychologist at Rutgers University, who is also a member of the DSM working group on eating disorders. So a third treatment option would be a combination of both of these sides. So you focus on the weight and the psychological components. And there's a lot of research being done on this, but there still needs to be more how you can incorporate them. So Stanford University psychiatrist Stuart Agras conducted research that people who abstained from binge eating following specialty eating disorder treatment were more likely to benefit from weight loss treatment in both the short and long term. But this is kind of inconclusive because people generally tend to go with one or the other side and not a mixture of both of them. So in conclusion, we have looked at what binge eating disorder is, who it affects, and the possible treatment options for it. Thank you.